Welcome to the Smile Sisters podcast, powered by the LA Dental Clinic. In each episode of the Smile Sisters, host Dr. Azy and Dr. Arezoo Nasiry show you how you can transform and maintain your smile. The sisters explain everything you need to know about your mouth and why keeping it healthy is key to your overall health.
So today we're going to be talking about wisdom teeth. So I'm going to ask you some questions that most of your patients are asking. Right? Common questions that we have. So the number one question is, do I have to take my wisdom teeth out? How do we know if someone has to take them out?
Right. So let's go back a little bit and just discuss what are wisdom teeth first.
Okay.
So wisdom teeth are basically like a third set of molar teeth that we get later on in life. And by later on, I mean between the ages of 16 to 20 something. So after you lose all your baby teeth and you get all your like adult teeth, you still have these other set of molars that come in, when you're like a teenager. Most people tend to take them out, and the reason has to do with the amount of space that we have in our jaws. Mm-hmm. Now, our ancestors living in the jungle, they were eating a lot of like tough foods and a lot of fibrous foods. So as their bodies became more developed, they needed more nutrition. So that's why nature gave them this third set of molars to help them kind of like chew and digest all that food. Nowadays, as you know, we don't have that kind of diet anymore. So our jaws have kind of like developed to be much smaller. And that's why now there's just no room for the wisdom teeth anymore. So we recommend to take them out.
So that's interesting. So now because we eat softer foods, we don't require such bigger jaws. And so what happens to these wisdom teeth if we don't take them out? What are the issues?
So the issues are, it's just a space issue. So it's just like kind of like trying to fit a puzzle into a smaller space. The pieces just don't have enough room. So they tend to like go on top of each other. With teeth, they don't go on top of each other, but they tend to get like kind of wedged in back there. There's no room. Sometimes they don't even come into your jaw, like you won't see them because they're just stuck under the bone there. And that can create a lot of issues. Most people kind of like, you don't feel anything, and then one day, boom, you get a big infection. And that has to do with just the bacteria being able to like seep in there over time. You can't clean it. It's under there. Nobody can clean it. And then one day you just have a big problem, like an infection or pain.
So what you're saying is take your wisdom teeth out if they are stuck in your gums. Don't wait until half your face is swollen out.
For sure. I mean, that's why we recommend it. And most people are like, I don't feel anything. Why should I take them out? But it's more like a preventative thing that when we already see you're not going to have the space in your jaw for them. It's better to take them out and just avoid problems later on. Yeah.
So one issue is that you can get a gum infection. And then what else? What other problems can you have if you don't take them out?
Another problem that we see a lot is that you will get a cavity in the tooth next to it. Why? Because it's stuck back there under your gum. It's basically impossible to clean, impossible to floss. Even like a dentist, can't get back there. But bacteria can get back there. So they do tend to get cavities in the teeth next to them or the wisdom teeth themselves. Right. So it all has to do with space and ability to clean the area. So if there's no room back there, things get stuck together, you cannot brush it, you cannot floss it, it's going to eventually have a problem.
And then isn't it also true that some people just aren't getting back, or even if their wisdom tooth is coming out straight, they are just not cleaning it because it's so far back, they're not getting to it.
Exactly. I mean, it's just, again, that also has to do with space. Yes, there was enough space for it to come in, but there's not enough space for you to clean it. I mean, you can imagine how hard it is to floss even your front teeth. Like, imagine trying to clean on a third molar back there. Like, you really do have to have a pretty big jaw to accommodate a tooth and be able to maintain it and clean it and keep it long term. So most people don't have that. Yeah.
So this is a benefit of having a big mouth.
Yeah. Okay. It's good to have a big mouth sometimes.
So let's talk about that. Who can keep their wisdom teeth?
So, I mean, you know, as you're going to the dentist for your checkups, maybe around the ages of like 14 to 18 is when they start to come in. And that's when you can really see, is there going to be enough room or not? And, you know, honestly, just like any surgery, the younger you are, the healthier you are, the easier it is and the better the outcomes. So if you are able to, you know, keep them, great. If not, it's best to take them out also, more like on the teenager age.
Got it.
Yeah.
So let's talk about that, the best age to remove your wisdom teeth. So they start to erupt when you're in your late teens, right?
Yeah.
But what is the ideal time to actually remove your wisdom teeth?
So around the same time, I would say, when they start to come in, you know, as we all know, me and you, as we get older, just surgery becomes more difficult to recover from. And wisdom teeth is just another surgery on another body part. It's just like any other surgery. So the younger you are and the healthier you are, it's much easier. Recovery is much easier. Also with wisdom teeth, the teeth are not fully developed. So it's actually like a smaller tooth to remove, which is also makes it more easy.
Basically, you're saying if you don't have enough room in your jaw, you can get a gum infection, you can get a cavity on the next tooth,
right?
Or you can get a cavity in your wisdom tooth if you're not able to clean it properly. So those are reasons to remove it, and you want to remove it in kind of your late teens before they fully erupt and before you get older, and then it's more difficult to have surgery.
Right, exactly.
But when you're in your teenage years, you're also considering braces. So how do braces affect wisdom teeth? And is that a consideration? If you're going to get braces, should you have your wisdom teeth out first? What do you think about that?
Yeah, totally. I mean, a lot of orthodontists will send you back to your dentist to have your wisdom teeth removed before braces. It's all about the same kind of thing. There's not enough space, and having braces adds another kind of like element of cleansing, you know, cleaning your teeth, which makes it much harder. So now, not only don't you have enough space, but you also have all this like braces and wires and things to deal with. So it just like exacerbates the issue of trying to maintain and keep it clean. So a lot of orthodontists will recommend to have the wisdom teeth removed for all these different reasons. So yeah.
And just to make room as well, right? Sometimes they actually want to move your teeth back into that space.
Yeah. Sometimes they need the space also for the bands that go around those molars. If the wisdom tooth is like, you know, kind of like stuck up against the next tooth, there's actually no room to place those bands. So sometimes they need the room to put in whatever they need to put in as well.
So we talked about why you should take them out. You can get an infection. But what if you ignore that? Because, you know, as doctors, we know, we tell our patients sometimes don't take them out, and then we see them coming back, and there are some serious repercussions to that. So let's talk about what happens in an emergency situation. Like if you don't take them out electively, which is when your dentist says you don't have enough room for them, so potentially you need to take them out, and you're like, yeah, I'll do it later. Yeah. And then what are some of the issues we see, and why is it that we're telling our patients, please take them out now?
Right. I mean, you know, and, you know, we see this all the time where we're like, I think you should take your wisdom teeth out. I think you should take your wisdom teeth out. And most of the time, you're fine for years and years and years. But then all of a sudden, something happens. You're about to get married. You get a flu. You're moving. Somehow your immune system is compromised. Yes. And now your body is no longer able to, like, put the resources to fighting this little bacteria in your wisdom teeth, and all of a sudden, boom, it blows up. I mean, we see it all the time. It's like, just, you know, I had a flu last week, and then now this week, my jaw is swollen. So it's actually like a constant battle that your body is fighting back there because, like we talked about, you can't clean it, you can't get back there, but bacteria can get back there. So your body is constantly fighting these bacteria and like suppressing an infection. But then all of a sudden, if your immunity is also down, it's like not enough. So all of a sudden it can blow up. So we're always trying to say, please take it out, you know, while you're younger, while you're healthy, before the roots are fully grown. Those are the times when it's easy and it has the least amount of kind of, yeah.
So to get a little bit technical about it, you have a constant chronic infection there, which is your gums are a little bit swollen, there's a little bit of bacteria, but because you're a young, healthy person, your body is fighting it off.
Exactly.
And
you just go on with your life and it's fine. But then one day, you know, your body needs a little help and there's not enough resources for you to keep fighting this.
Yeah.
And it just
You
blows
talked
up.
about travel. When you get on an airplane,
Yeah.
talk a little bit about some of the things that happen when you have an infection and you get on a plane.
What do you mean? About the pressure?
Yeah. Yes. That's usually when things blow up.
Sometimes, yeah.
It's true.
It's true. I mean, travel in general tends to have a lot of stress involved. And I think that's part of it too. It's not necessarily just from the pressure of going up and down. But yeah, I mean, travel can create, but I see it a lot with good stuff like getting married, having a baby. All of a sudden, you know, this kind of like random stuff pops up. It all just has to do with your body not being able to continuously fight that chronic like little infection that's going on.
Okay, so you want to basically take your wisdom teeth out when your dentist recommends it, if they recommend it, before it becomes an emergency.
Exactly.
And often people who are taking their wisdom teeth out are late teens, early 20s, so they're maybe college students.
Right.
So let's talk a little bit about when do these people normally want to take them out, and what's your recommendation for timing?
I mean, you know, you want to give your body a chance to heal for a few days. Like I wouldn't plan a big speech or running a marathon or something. Like, you know, maybe you want to do it on a Friday and have the weekend to recover. But again, it's so variable because of, you know, if you're younger, you're just going to heal faster. If you're older and it's already infected and it's already had issues, you need more time to heal. So I would say, you know, at least a weekend, maybe a week, just to like let your body rest and recover and kind of like take care of yourself.
So I want to thank you guys for listening to us today about wisdom teeth.
Thank you. I'm glad that you are taking the time to learn more about it. But next time we're going to be talking about something a lot more fun, which is cosmetic dentistry and smile makeovers. So please join us for that.
And if you want to find us, go to ladentalclinic.com. And we do free virtual consultations, or hop on into our office and we can tell you whether your wisdom teeth need to come out.
Yes, we can.
Thank you for listening to The Smile Sisters. If you found this episode helpful, subscribe and leave us a review. To book a free consultation, go to ladentalclinic.com.